Good evening, everybody. This is Trifini Mchikasera. In Zimbabwe, it's evening. In the UK, it's good evening. In the US, it's good afternoon, depending on wherever you are. Can you hear me, everyone? Can you hear me? Wonderful.
Yes, we can hear you.
Yes, we can hear you.
Thank you very much. I would like to welcome you to tonight webinar, which is Zimbabwe chapter hosting. My name is Trifini Muchikasera. I am the TORG-ZIM chapter leader, chairperson. I would like to welcome you tonight to our inaugural webinar. This is our first inaugural webinar for Zimbabwe chapter, and we are excited tonight. So I would like to welcome everyone. We have tonight 18 countries participating with us today. This includes Zimbabwe. We also have Nigeria, we have Senegal, we have Kiribati, we have Nepal, Saudi Arabia, Namibia, representative from Zambia, Ireland, Rwanda. We have St. Lucia, India, Pakistan, Ghana, England, Ethiopia, and Tanzania tonight. I would like to welcome you. Tonight, before I go into the today's business, I would like to just give you a brief on the talk. We may have new people, we may have some who have just joined us today. I would like to give you just a brief about the operating room globe. It is a very big platform, a multidisciplinary platform for the operating room. About 42 disciplines are in this from 104 countries across the globe. So this means it is a very big platform for the operating room personnel. So tonight, I would like to just take you a little bit. Like I said, it has got 104 countries on a multidisciplinary platform of professionals, which is about 213,000 perioperative professionals across the 104 countries. As you see that in the operating rooms, there's different kind of disciplinaries. 42 is not a small number. So tonight, I also want to welcome, we have TORG leadership among us. Tonight, we have our president, Professor Debsola Okole. May you please help me to welcome her tonight to our initial webinar in Zimbabwe. So during the webinar, we are allowed to put our questions in the question box so that they will be attended to. If we have any questions, you may drop them in the inbox so that they will be the first to be attended to. We also have, it is a recorded one. So if you have colleagues, they may also benefit after this. We also have a YouTube channel, which may go hand in hand while we are presenting live here on the webinar. So tonight, I would like to welcome our secretary, Mrs. Blessing Ogu. I hand it over to you, ma'am.
Thank you so much. Thank you so much, Trifin, for having me. So I'll go ahead to read our speaker bio as we raise him. So, ladies and gentlemen, it is my honor to introduce our speaker for today's section, Ms. Nothando Dube. Mrs. Dube is a registered general nurse with advanced training, holding a diploma in operating theater nursing. She is currently pursuing a degree in public health, demonstrating her commitment to continuous learning and improving healthcare outcomes. With significant experience as a surgical assistant, Ms. Dube brings a deep understanding of preoperative care, patient safety, and surgical teamwork. Beyond her clinical work, she holds a critical leadership position as the board chairman of the Northeast Council of Zimbabwe, where she championed the professional development and standards of nursing practice across the country. Today, she'll be sharing her insights on the topic, comprehensive preoperative management, enhancing patient safety and surgical outcomes. Please join me in warmly welcoming Mrs. Nothando Dube as she leads us into this important presentation. Ms. Dube, the floor is yours. You're welcome. Thank you.
Talking about enhancing surgical outcomes and patient safety. The introduction is perioperative care is the collaborative care given to patients before, during, and after a surgical or invasive procedure. Effective perioperative care requires seamless collaboration among multidisciplinary teams, leveraging electronic health records for real-time information sharing, patient-centered approaches that foster trust and engagement, while evidence-based enhanced recovery. After surgery, enhanced recovery after surgery protocols optimize outcomes by minimizing stress, accelerating recovery, and reducing costs. This is what, as operating theater personnel, is our main goal, where our patients recover at reduced cost. Then the critical phases of perioperative management. Perioperative management guides patients through surgery, safety, focusing on preparation of surgical care and recovery. Each phase aims to maximize safety, minimize complications, and promote better outcomes. And these three phases are the preoperative phase, the intraoperative phase, and the postoperative phase. On the preoperative phase, the preoperative phase initiates the patient's surgical journey. This is when we meet the patients. This is where we are setting the stage for a successful surgery outcome. A comprehensive preoperative assessment is essential, focusing on medical history, physical examination, and diagnostic tests to evaluate a patient's optimum health status and identify any potential risk or complications. This is the stage where we look at patients who are maybe a diabetic patient who is supposed to come for an operation. This is when we pick it, when we do the diagnostic test and the physical examination. Then we'll know how we are supposed to manage the patient. Remember, we all know that we usually say a patient should be on nil per os, some of them we put them on nil per os 8 hours before a procedure. So this will make us tailor-make the management of the patient according to the conditions. Not every hit no, not every head fits everyone. So when we get the right diagnosis, the diagnostic test, and we get the results, we'll know which type of patient we are dealing with. I might come to a hospital and I don't know I'm diabetic. So when those assessments are done, these results will determine what kind of treatment, what kind of nursing care is supposed to be designed for me before my surgery. So this will assist the operating team in reducing the risk and complications. These assessments helps in developing individualized care plans, optimizing patient preparation, and mitigating perioperative risk. Then we go on to communication. The communication with the patient ensures the understanding of the type of the surgery, expected outcomes, potential risks, and post-operative care instructions, and ensuring the patient signs an informed consent for the surgery. This enhances understanding and cooperation, contributing to better adherence and recovery. It also addresses concerns or anxieties and improves patient satisfaction and reduces perioperative stress. This is where we now educate the patient. Patient should be fully informed of what is going to happen to him or her and what is expected post-surgery, where we are supposed to give them the information so that when someone else manages the patient post-operatively, they now understand their condition. So there is no anxiety, not knowing what's going to happen in the next stage. How long am I going to stay in the hospital? Though we don't have the actual number of days, but at least if you explain to your patient, they have that clear understanding. There are major operations where you'll be expecting someone to stay in a hospital for a longer time. But during that time, that's the time to allay all those anxieties so that when we go into theater, we don't have the anesthesiologist worried about the patient's blood pressures getting elevated and most of them, they'll be seeing the theater staff for the first time. So this is the communication phase where we always encourage the theater personnel that when they go to visit these patients, you should go in the attire that they will see you in when you are in the operating room, so that there is no anxiety when they see you in your gowns and in your goggles and in your mask and that gown and everything. So at least when you go and communicate with them, don't go in those nice uniforms. They need to see you in those attires. Yes, they are no longer going to go into theater after that visit to the patient, but at least we've assured them and they are prepared for you in that. In parallel, the OR room nurse meticulously follows all protocols and ensures that all safety measures are adhered to. This involves preparation of the operating room, setting up the necessary equipment, ensuring all equipment and instruments are sterilized and ready for use, and organizing the surgical team to ensure a proper and smooth surgical process. The nurse must also verify that all equipment is functioning properly and that backup systems are available. They are in place. This is where we are now saying, you have seen the patient. I've had cases where the operating bed, we all know it's so small. And because at times, I don't know whether it's lack of staff, I know we don't usually have adequate staff. Then the patient comes, the patient cannot fit in our operating table. You now need to move when the patient is there. How do you feel? I invite you to my house and you come and there's no bed for you and we start looking for it. You feel like maybe they were not prepared for me. Maybe they didn't want me. So that preparation now improves our communication and our reception to the patient, because if it's someone who is big and cannot fit in that bed, you would have noticed that in the perioperative phase. So you will know which theater to put the patient and which bed to use on the patient. So that when she comes in or when he comes in, the bed is already ready for him. There is no need for him to be shifted. So everything will be ready. And you have backup. We don't expect a diatom machine to multifunction during the procedure. You should have a backup. Then the intraoperative phase. This involves the actual surgical procedure, requiring meticulous attention. My slide has moved to post-op. Intraoperative phase, requiring meticulous attention to patient safety, anesthesia management, techniques, and other critical aspects. Anesthesia administration tailored to the patient's specific needs and surgical requirement ensures effective pain management and stability throughout the procedure. Advances in surgical techniques such as minimal invasive and robotics assisted surgery offer several benefits, including reduced tissue trauma, faster recovery times, and improved surgical outcomes. Surgical teams follow strict protocols, including infection control measures, to minimize the risk of surgical site infections and other complications. Furthermore, intraoperative monitoring and communication among the surgical team enables swift recognition and management of any issues that may arise, prompting patient safety and procedural efficiency. Adherence to evidence-based guidelines is crucial for achieving optimal outcomes during this critical phase. This is the phase where we now have the patient in theater. When you talk about the surgical protocols, we are talking about the surgical checklist, the instrument checklist, the swab count, and the sharps count that the ORNS should have, and these are supposed to be done before surgery starts, during the surgery, and post. When you have completed your surgery, you need to do all those so that you ensure that there are no instruments, sharps, or swabs are left in the patient's wound, especially if it's a cavity. So you need to do, those are the protocols that we talk about when we talk about adherence to protocols. The post-operative phase is a crucial period that begins immediately after surgery and continues until the patient regains their health stability. During this time, close monitoring in the post-operative care unit or the recovery room is essential to assess the patient's vital signs, pain levels, and overall recovery progress. This allows the healthcare professionals to quickly identify any potential complications such as respiratory problems, bleeding, or adverse reactions to anesthesia, and take prompt action to prevent them from worsening. Effective pain management is also critical during the post-operative phase. A multimodal approach that combines different types of pain relief medications, regional anesthesia techniques, and non-medication interventions can help minimize discomfort while reducing the risk of opioid-related side effects. Additionally, patient-controlled analgesia, PAC devices, give patients more control of their pain management. This is where they'll be using the controlled analgesia, which is programmed by the healthcare worker using a pump to deliver a specific dose. This is when the patient, when they feel they are in pain, they press the button to receive a dose. This is safe as it is built with safety features to avoid overdosing the patient. So you just have to educate the patient on those, and they can use them on their own. And it also makes them feel they are part of their care. This allows them to administer the medication needed within safe limits. This not only improves their comfort, but also enhances their overall satisfaction with the care. Nursing care is vital to a successful post-operative recovery. Nurses play a key role in providing wound care, promoting mobility, and educating patients on how to care for themselves after discharge. By encouraging early movement and respiratory exercises, nurses can help prevent complications such as atelectasis and venous thromboembolism, which can slow down the recovery process. By providing high-quality nursing care, healthcare providers can help patients recover more quickly and reduce their length of stay in the hospital, thereby also reducing the charges for the hospital. We know our hospitals are expensive. Everyone loves serving them. Then the conclusion. Effective perioperative care encompasses a range of evidence-based strategies designed to improve patient outcomes throughout the surgical journey. By prioritizing thorough perioperative planning, precise intraoperative management, and attentive post-operative support, healthcare professionals can significantly enhance patient safety, satisfaction, and recovery rates. Ongoing developments in perioperative practices, coupled with collaborative efforts among healthcare disciplines, play a crucial role in defining the future of surgical care, leading to enhanced healthcare delivery and improved patient outcomes. So this is what we are looking at, so that we have our patients cared for properly, so that we have our patients not suffering because we missed some of their something during our care. We expect them to get the best from us as the healthcare professionals. Then I'm going to talk about the other factors that I was trying to load. You know, I'm old, I think. I'm not tech savvy. So there are other things that I'll talk about, but for those that are recording, I'm going to send it to the admin so that it's actually added to the presentation for reference sake. So the importance of communication and teamwork in perioperative management. Effective communication among surgical teams is vital for patient safety. This is actually, it's across all the phases of perioperative care. You need to communicate in the preoperative phase, in the intraoperative phase, and in the postoperative phase. Preoperative briefings, intraoperative communication, and postoperative debriefing minimizes errors. Using structured tools like the checklist improves the coordination and ensures shared understanding among the healthcare professionals. Then we go on to risk assessment. This also goes on all the three phases, because at every phase we are looking at the risk assessment and how to manage those risks. Identify patient-specific risks, e.g. comorbidities. allergies, surgical complexity during pre-operative assessment. Use risk scoring systems, ASA-score, to stratify surgical risk. Implement targeted strategies, optimize comorbidities, antibiotic prophylaxis, and venous thromboembolism, VTE prevention. We've seen in some other theaters where the patient for thromboembolism, the stockings are actually ordered pre-operatively, and the patient goes to theater with them, where the anesthesiologist will have the patient put them on during surgery. The technology in perioperative care. Telemonitoring allows remote observation of vital signs during recovery. Electronic health records, EHRs, provide real-time patient information to all team members. Robotic-assisted surgery enables precision, minimal tissue trauma, and faster recovery. Digital tools enhance documentation, they reduce errors and streamline communication. So I have a case scenario of a patient, an elderly patient who is undergoing an orthopedic surgery. An 82-year-old female patient is scheduled for a hip replacement surgery. The preoperative phase, comprehensive geriatric assessment. This is what is supposed to be done for this patient. Medication review to minimize polypharmacy risks. Physiotherapy, rehabilitation to improve strength. This is done to the patient before the procedure is done. So patients will be aware that, like with physiotherapy, this is what is going to happen. So when you now take the patient for physio post-operatively, you do not have challenges because the patient already knew about that. That's supposed to be done on her. Then the intraoperative phase for this patient, regional anesthesia, e.g. spinal anesthesia, to minimize this risk of systemic complication. If you look at the age of the patient, is an elderly patient. Minimally invasive surgical technique to reduce blood loss. The post-operative phase, early mobilization and physiotherapy initiation within 24 hours post-surgery. Fall prevention strategies are supposed to be implemented. This is where the patients are put in the cot-sided beds and they are put in the normal size bed. We don't want the high beds for them because they might try to move on their own. Fall prevention strategies are implemented for this patient. Multimodal analgesia to control pain and minimize opioid use. Then the summary, comprehensive perioperative management ensures patient safety and enhances surgical outcomes. The key elements include thorough preoperative preparation, meticulous intraoperative practices, attentive post-operative care, emphasizing teamwork, risk management, evidence-based protocols, and technology adoption, which leads to a better recovery, reduced complications, and higher patient satisfaction. That's all. I'd given the conclusion earlier. Colleagues, this is all that I had for you today.
Thank you.
And we can now go to the... Over to you, Madam Chair.
Thank you so much, our speaker, for that wonderful presentation. That was so impactful, taking us through all the preoperative management, starting from the pre, intra, and post and also go ahead to talk other areas. That's so wonderful. So this time is time for questions. If you have any questions, you can do well to raise up your hand, or you can use the chat box. So I will go ahead to read out the first question that we have in the chat box here from Uwesi Roda. The question is, in additional of protocols, policies, guidelines, effective preoperative care require a dynamic team, self-motivated personnel, full of empathy. The question is, what do you do to have such teams? Please share your experience.
So that when we are having cases, you find the imaging group, they understand how theater operates. Because I'll give you a case scenario. When I was a little sister, a junior sister at Mpilo, we had these theater nurses. And when I was growing up as a junior sister, I used to think the people work in theater, they think they know more than anyone in the hospital. That's my attitude. Why? Because we're not educated and they were not engaging us. So I feel if in any particular hospital, you need to engage the allied professionals and other nursing staff so that they understand the operating room personnel and how you guys operate. Because at that time, the anesthesiologist will come and prescribe pre-medication for patients, right? And then we're supposed to give the patients before they go to theater. And then when the theater nurses come they used to visit for the pre-op visit. So they would ask, can you make sure you give this before the patient comes to theater? But at times, like, you're a junior sister, you don't know much. So you forget to give, or you are busy with something else and you're told, can you take this patient to theater? You don't check everything properly and you will the patient to theater. So the first time I encountered the theater nurses is like, they were like, why didn't you give this? And I told them I forgot. And then they shouted at me. Then I was like, that's the reason why everyone lies to you, even if they don't give. They told me to tell you I've given, but I'd not given. That's why I'm telling you the truth. So it's how we educate our colleagues for them to accept and be part of this comprehensive care. We need to educate each other. I feel everyone is empathetic, but at times it's due to lack of knowledge where they don't understand what our demands will mean. Then I didn't understand that they want to allay the anxiety of this patient. That's why I'm supposed to give the pre-medication. I didn't understand it's to reduce even the blood pressures of the patient so that the patient is calm. And when they put the patient to sleep, they don't have any events. But then I didn't understand. So it's our duty as the operating room technicians, allied professionals, the anesthetists, when they go to see the patients in the ward, to educate the other professionals. Because at times sending you, when you phone them like you want an image intensifier in theater, maybe you are doing a certain procedure, you encounter a complication, you now want them to come. They know it's urgent in theater, they will come running. So I think it's our duty for them to be part of the team, be empathetic and self-motivated. It's us as the operating room staff to engage them, communicate with them so that they understand how we work. That's my thinking. Thank you, Madam Chair.
Yeah, thank you so much. I love the answer you get because once you mentioned about it, when you talked about communication, and that communication is good in every stages, starting from the pre, intra, and post. So maybe before any procedure, for a good team, to have an empathetic team, there's need for good communication. Briefing, even sharing the cases. Yeah, even if it tells, sharing the patient cases, making sure that every team members understand the patient conditions, the complications that might occur, and making sure that every team members knows their roles, because this will help them to stand and knowing that, yes, I know my role, I know what you're expecting, and I know what we don't want, any complication concerning this. This will enhance, I'm just saying this in addition to what you said, because this will also help to, improve the empathy among the team members. Okay, thank you so much. That was a great answer. Is there any other question? You can also use raise up your hand, or you can use the chat box concerning this topic. Is there any other question? You can use the chat box, or you can raise up your hand and ask your question based on this, maybe about the pre, intra, or post, or any protocols that you need more clarification about. Okay. So in the absence of no question, I will be handing over to the chair to continue from here. Okay, you have a question. Someone, the mic is yours. You can go ahead and ask your question, Belinda.
Yes, I raised my hand, but maybe you didn't see. Yes, so first of all, I want to thank Miss Dube. I hope I got the name right. Thanks for the presentation. And to add to the question you asked, I think that teamwork is an all-encompassing situation. And in a dynamic environment like the perioperative setting, we need all of us to be together. And in addition to all that you guys have said, I want to add that we need an effective leadership as well. Leadership that creates that environment where nobody feels intimidated. People are free to share their thoughts without fear. An environment where there is trust, so that we are able to come together as a team, even when errors occur. It is not about punishing, but it's about learning out of it to get better. So for me, that is what I want to add. And of course, knowledge of the team members, education, as Ms. Dube said, until we are all at the same level where we understand the needs of that environment, it will be difficult to have an effective team. But a situation where we all understand what is supposed to be done there and why we do them, then it becomes easier to have an effective team. And then also, like I mentioned about leadership, a leadership that shares the vision with the people, that environment, what are the needs, what is the goal of that setting. So you share the vision, sell it to the people, and let them own it. Once your followers or your team owns the vision, it becomes easier to carry it out. It becomes easier to journey together. And once we are moving together, I think that is where the trust and the teamwork, comes in. And of course, the communication or all other aspects of a dynamic team, comes to play. So thank you. That is my take.
Thank you so much for that addiction. That was so also an eye-opener too. Okay, thank you so much. Is there any other person that have a question? Okay. So I'll be handing over to our chair to continue from here. The mic is yours, please.
Thank you so much, Mrs. Blessing. I would like to thank everyone tonight. My sincere apologies. There is Kazakhstan in the house. I forgot to mention them in the initial introduction. I would like to thank you so much for the support and the participation of each and every one of you. Your input will actually make our practice better, and it will actually improve us as we continue to learn iron sharpening iron. Thank you very much. Members, can you help me to thank Mrs. Dube, Nothando Dube, Sister Dube? Would like to thank you. The energy, the confidence, you know, the depth of the research. I know you did a very good job. You are actually raising our, this is our just our initial webinar, but you just nailed it. It was so impactful. It was so compelling. I would like to thank you so much. The house, can you help me to thank her? Thank you, Ms. Due. We really appreciate your input. Thank you very much. That was so powerful. So we will have the presentation is in the chat box. Those who want certifications for the attending for continuous education, you can actually go into your inbox. You'll find a link from our president. You click the link for evaluation. After evaluation, it will open up in your Google Chrome. Then we are able to download your certificates. Also, there's a recording. Those who need a recording, you can go also on YouTube. You'll find the presentation. I would like also to encourage you to join on Sunday on the same time the TORG webinar with the topic of the future of surgery. Please kindly register. It's quite a good thing to register for the next Sunday, the same time. I would like also to take this opportunity as we close to thank our leadership of TORG.